Hello, it's Dr. Patricia Coughlin here, talking to you about ways you can improve psychotherapy outcomes, and in so doing, also enhance your own sense of meaning and purpose and effectiveness in the work you do. So, today I'm going to talk to you about one of the factors consistently associated with positive outcome in psychotherapy, and that is the issue of focus. There's all kinds of research, really starting back in the 40s with Alexander and French, and up until the present time. I'm going to talk about research from Ulrich. I hope I'm saying that right, Yulish. I'll have all the information down on the bottom so you can check out the research yourself. Research over many, many decades, making it quite clear that focused therapies are far more effective than those that lack focus. And also, not only that focus is highly associated with outcome sort of from beginning to end, but also focused therapies have much lower relapse rates. Moore found that a lack of focus is actually a negative factor. It is associated consistently with poor outcomes and also with high levels of relapse. So what kind of focus are we talking about? What really is a therapeutic focus? Well, there's research on this as well. And it looks like a focus on the internal life of the patient, something he actually has some control over and can change, is the kind of focus that's associated with positive outcome. Yet many of our patients enter therapy with an external focus. They might be there because their mother or their husband suggested they come, or because they think their problem is outside of them. They're in the wrong job, or it's really their kids that are causing the problem. So it does in fact take therapeutic skill to help a person see how their problems out there in the world are actually a reflection of some kind of internal problem or conflict. Again, the research on this is not very heartening. This Yulish, Yulish, et al. Did a recent study on this, and once again they found this hearty relationship between focus and outcome. That was the good news, but the bad news was that the therapists really had very little effect on that. So in other words, patients who already came in with an inner focus, right? They already knew that their anxiety was a problem and it was something they were actually contributing to. So these folks did better than those who had no focus or had, in a sense, a mistaken focus. And unfortunately, in that study, the therapists who had those unfocused patients were not successful in helping patients develop that capacity. So that's something really important for you to focus on and develop, a way to help a patient begin to turn their focus inward on the problems they are having in dealing with whatever the external challenge is that they are facing. So a lot of this I cover in my books, and so you can dive into that more deeply. How to create an internal focus when it doesn't exist from the start. And again, that's pretty often. So let's say somebody comes in, like a patient. I'm actually going to be showing this case at the IEDTA conference in September next month in Boston. And this was a man who came to see me because he was in hot water with the wife, who had caught him using pornography. And so when I asked him if he thought this was a problem, he said no. It didn't bother him at all. He wasn't anguished about it. He was only concerned that his wife was upset about it, and he didn't want to lose her. So that at least was a start where I could begin to wonder with him about this tendency to behave in ways that would actually undermine the very thing that he wants, which is a happy, healthy, and long-standing relationship with his wife. But we had to continue to explore this problem so that we could identify the issues that he was actually concerned about. And that highlights a finding from another study by Tomlinson. And they found that just focusing on the presenting problem and then maybe trying to go about fixing it was not nearly as effective as therapists who tried to help the patient understand their presenting problem and to put it in context and to actually develop sort of not just an understanding but an explanation that made sense to them. So let's again take, for example, someone who comes to see you because of panic attacks. And as you begin to focus in, again with specificity, in a phenomenological way, what they mean by panic attack, what was a recent time they had one, when was the first one, and then are they able to see that there's some theme here, some typical trigger that would activate it. You will often find that the patient is completely unaware that they are anxious in the moment. So they think the problem is that they have these panic attacks, but you might notice they're wiggling around in their chair and biting their lip and wringing their hands. And I might say, and are you aware that you're anxious right now? And again, I'm thinking of a particular patient who said, oh, no, this is nothing. I said, you mean you tend to ignore or just overlook anxiety at this level? Oh, yeah, they said. I said, okay, but let's look at that. And so when we zeroed in on the actual experience of anxiety in the moment, this fellow realized that it actually started to go down. So this was a very powerful experience. He was able to see that it was his very tendency to ignore, to avoid, to override, talk over his anxiety that actually set him up for having panic attacks. In other words, anxiety was getting triggered and it was building over time, making a panic attack at some point inevitable. So even though he originally thought panic attacks were the problem, as we started to understand the problem, we could really see this underlying mechanism, that it was his tendency to avoid, minimize, and detach from his anxiety and also other feelings, as we found out, that actually set him up for what was the presenting problem. So here is an example of helping the patient understand the problem and the underlying mechanisms responsible for it. This kind of work, it looks like, is much more effective than just taking the presenting problem at face value and going to work on that. So I hope this will just spark your interest in this topic, really get you to think about what is a therapeutic focus, how do you get and then keep this internal focus on the patient's internal world and the kinds of conflicts that they're experiencing that are actually responsible for their symptoms and suffering, so you can target those. So again, let me know if this is helpful to you. I'm going to be alternating these posts on very specific factors where particular tasks and techniques are useful. And then that's going to be alternated with these other posts really on who you are as a therapist, like the one I recently posted on knowing your why. And in fact, I've gotten quite a bit of feedback on that, with requests for how do you discover your why if you're not clear about it? Or how do you help your patients get connected to their why? So I'm going to do another post on that as well. So thanks for listening. Give me your comments and questions and we'll just keep going with this. Okay, thanks. Bye-bye.